All right, so my name is Nicole Byram. I'm a registered dietitian with Celiac Canada. Welcome tonight, Diana, and welcome to everybody tonight for this really exciting webinar. I'd like to take a moment to, first of all, acknowledge the lands that we're on. So I am here in North Vancouver on the ancestral lands of the Musqueam, Squamish, and Tsleil-Waututh Nation, and here we promise to live, learn with much gratitude for this land. So wanted to take a moment to do that. And then introduce our speaker tonight. So Diana Major is a professor of clinical nutrition in the Department of Agriculture, Food and Nutritional Sciences, and the Department of Pediatrics. Diana obtained her PhD at the University of Toronto, related in pediatric nutrition in children with chronic liver disease, and worked for several years as a clinical dietitian at Sick Kids in the division of GI, gastroenterology, and hepatology and nutrition. Her primary areas of research at the University of Alberta include the development of nutrition support and nutrition education interventions for children and youth with chronic gastrointestinal and liver disease. Diana's clinical endeavors include ongoing work as a registered dietitian in Ontario, where she continues to provide dietetic support to children and adults on home nutrition support. Diana is passionate about pursuing clinical nutrition research that will result in the development of improved nutrition in children with celiac disease, and she is here today to present on the Gluten-Free Food Guide for Children that was developed by her research team at the University of Alberta. So without further ado, welcome, Diana, and we look forward to hearing all that you have to inform us about tonight.
Thank you so much. I really appreciate the opportunity to discuss the Gluten-Free Food Guide for Children and Youth with Celiac. That was developed by myself, Dr. Justine Turner at the Stollery Children's Hospital, and my Conquer research team.
I will say, sorry, Diana, just not to interrupt you, but I know that you will have questions at the very end. So what I will ask everybody to do is please put your questions in the Q&A portion. We can capture them there. We'll leave the chat just for kind of where you're from this evening, but the Q&A will be for the official capturing of questions. Thanks so much, Diana.
No problem. Thanks again. So why do children and youth with celiac disease need their own food guide? Well, there's lots of evidence that children and youth with celiac disease have higher intakes of sugar and fat and glycemic index and lower intakes of micronutrients such as folate and iron. And this is particularly true when you consume processed gluten-free foods. Canada's Food Guide to Healthy Eating is great, but it doesn't really consider the unique nutritional considerations of the gluten-free diet. And so there was a need for the development of evidence-based nutrient information about the gluten-free diet that is practical, easily accessible for the public, and that provides pertinent nutrition information that meets the needs of children and youth with celiac disease and their family. But this tool is not meant to replace other educational tools or spending time with a registered dietitian. I'm a registered dietitian, and registered dietitians provide really important dietary advice about the gluten-free diet. But it can be used as an additional information source. And so when we went our team to develop the Gluten-Free Food Guide, we really wanted to make sure it was based on similar principles as the Alberta Nutrition Guidelines for Children and Youth, or ANCSI, and Canada's Food Guide to Healthy Eating. We wanted to ensure the recommendations are evidence-based, ensure that the guideline recommendations will meet the nutritional needs and requirements of Canadian children and youth who consume the gluten-free diet. The recommendations are age-specific and consider the ethnic diversity of Canada. So hence, we included reference to the dietary reference intakes to ensure that our guide met those for age and sex. And the layout is similar to Canada's Food Guide from 2019 in that we developed a plate model. So here are some of the steps we did. We did a scientific review to evaluate the dietary concerns of kids with a gluten-free diet. We evaluated current dietary intake as illustrated in some of the papers we've written. And we developed over 1,200 dietary simulations within the different age groups and within a variety or range of different varying ethnic cuisines, and published those results. And we also approached you, the consumer, families and children with celiac disease, adolescents, to ask what you'd like to see what should be in a food guide. And we also asked registered dietitians across the country as well what they would consider would be important to include in terms of topics, information that would be really useful and helpful. We also, conducted this study using 3 different steps. So once we developed the food guide based on the feedback, we went through an extensive evaluation process from stakeholders, again, children, adolescents with CD, their parents, healthcare professionals across the country in a variety of focus groups where we elicited feedback on all the content of the teaching materials. We also evaluated the influence of what factors might affect uptake, like the food prices and the rising food costs of the gluten-free diet, and evaluated what current youth's intake was like and how it would potentially could be influenced by food guide recommendations. So here's what the food guide looks like. As you can see, it's a plate. A little bit more than half of the plate, and I'm going to show you on the next page, Health Canada's plate is a little bit higher in fruits and vegetables. And one of the major reasons for that is that gluten-containing grains have mandatory fortification of folate. But in contrast, gluten-free containing grains, that is voluntary. And so in order to ensure that Canadians can meet their folate needs and a variety of other nutrients such as iron, it was really important to include a wide diversity of fruits and vegetables, which are naturally occurring gluten-free foods, in the evaluation overall of the plate. And so that's why it's shifted over a little bit. We also have some different recommendations, which I'll show you in the next slide, comparing to Canada's food guide. We also include for children the recommendation that each meal should include an unsweetened milk or a vitamin D and calcium fortified plant-based beverage with your meal. And then we, of course, are emphasizing eating a wide variety of plant sources of proteins, nuts and seeds, for example, in the food guide. And we developed menu simulations which would evaluate to ensure that Canadian children would meet their needs. The messaging on the second page of the actual food guide is also really important because it suggests, again, that we should read food labels and ingredient lists for gluten and nutritional content. And that's what the members of the public are already doing, but also the same similar messages that Health Canada promotes in terms of cooking at home, choosing grains that are labeled gluten-free, and then drinking water. Water is really important for children for growth and development, and so ensuring that you get enough hydration involved in that. So very important health messaging. And then you can see here's what our plate looks like compared to Health Canada's. So the inclusion of milk, for example, or a plant-based beverage that's vitamin D and calcium fortified is really important for growing children. Children have specific needs for calcium and vitamin D to grow. And as you know, we live in a country, especially in Edmonton in northern Alberta, where we don't have a lot of sunlight exposure. It's -10 today. It's like Florida here today, but a lot of the time we are exposed to reduced sunlight hours, and that can impact vitamin D status. So it was really important in the simulations to include those as an option. Plant-based beverages that are vitamin D and calcium fortified are great options if unsweetened cow's milk doesn't fit within what you would like to eat. You can also see, again, we have very similar patterns of what goes into the protein group with a large emphasis on plant-based protein sources, but also does include animal-based proteins. And then you can see that our plate on the left-hand side is really focused on a wide variety of fruits and vegetables, but just a little shifted over to the right. And a lot of that has to do to ensuring that Canadians can meet their calcium needs, so children with celiac disease, and their folate needs, along with some other nutrients such as iron. So when you look at the food guide, the table of contents, I'm just going to briefly show you what some of the teaching materials look like. So the first a part of the remaining part of the guide focuses on single nutrients: iron, folate, fiber, fat, and sugar. And this just shows you a little bit about what the first pages of these handouts. These handouts can be used in isolation as single 2-page documents. They've had lots of feedback for a layout and give helpful tips about how Canadians can meet their micronutrient needs, alongside with calcium and vitamin D handouts. This is really important because vitamin D is a nutrient at risk in the Canadian diet, as I mentioned previously. So these are some examples. We have some tips about smoothies, and some other tips and suggestions about how you might make things child-friendly, and offer kids foods that they'll like and enjoy to eat. So this is where sometimes my computer goes a little crazy, and I'm sorry about that. So I'll flip back again to this version. So grains, we have information about different grains, oats, and pulses. And we again have information. I'll try again with, hopefully this will happen. Yep. Oh, there it goes. It works now. In pulses, information about ovo-vegetarian, gluten-free diets, vegan diets, lactose-free. So you can see again some specific suggestions, how to read food labels, what kind of words you're using. And on, often the second page of these, tips or to help you eat a healthy vegan diet, for example, so that you can meet your needs. We also give information about how to read food labels, grocery shopping, eating on a budget. So again, here is a variety of tools. Eating on a budget is a big topic now with the increasing rise of the cost of gluten-free foods, is really putting a strain on Canadian households with children with celiac disease, because the cost of gluten-free foods have outpaced the rising prices in gluten-containing foods. And we have tips on eating out, travel, because that's really important now that COVID's over. A lot of us are traveling. And then breakfast, for example, some tips on how to eat, and with breakfast ideas, school lunches, we give ideas, suggest ideas for school lunches, and healthy snacks. And all of these will be really important in order to help kids and families translate these recommendations into the schools. And again, not meant to replace other existing tools, but perhaps to be used in addition. So what are some of the other things we've been working on? Just so you know, we've been working on translation of the food guide into some languages. I have many nutrition students trying to work on that. So French, for example, this one is an example of Hindi, Ukrainian. We also have translations we're working on in Punjabi, Urdu, and a variety of other languages like Spanish, for example. So here's an example of the Lacto Vegetarian handout that's been translated into Spanish and Arabic as well. And as I said, we are definitely looking for volunteers who have a nutrition background who might want to support us in the first phase of translation, which is to translate the document, and then we'll be applying for funding to support professional language translation from these translations. But it is really important to us to reach out to varying communities, and to really pursue making this resource available for Canadians whose perhaps English is not their first language. And I think that's really important. We have a strong commitment to developing these materials. And so this phase is in process. We also wanted to spend some time looking at what was the effect of diet counseling using this food guide in clinic. So we wanted to compare, in Alberta, the approach for newly diagnosed children and youth is they get a group class across the province, within different sites, online, on Zoom, on this platform, where they're given an initial teaching. So we wanted to compare the standard of care, which was that approach, to the use of that standard approach plus the gluten-free food guide. And then we wanted to evaluate, were there differences in terms of, was the guide helpful in terms of improving dietary intake, particularly in the range of diet quality. So looking at the diet of kids from a total perspective, from a variety, moderation, and adequacy perspective, but also from our fruit and vegetable consumption, because that's really important to promote with these guidelines. And so these results here with these bar graphs show that fruits and vegetable consumption increased over 3 months in the group that received the counseling for that included the gluten-free food guide. So orange is kind of like the baseline, and then the red is what happened at 3 months. This is the standard of care group in yellow and green, and we saw significant increases in overall fruit and vegetable consumption, and some significant increases in comparison at 3 months to milk consumption. And when we looked at diet quality, again, we saw in the group that included the GFG, we saw that their diet quality score did improve, though it needs more improvement. And that was related to, because of the increased fruit and vegetable consumption, that resulted in people being more likely, the kids being more likely to meet their DRIs and to eat a wider variety of foods. In particular, in the fruit and vegetable component, they ate more fresh orange, red, and yellow vegetables, and they also experienced total increase in cruciferous vegetable intake. So this is just the 3 months results. We studied this over 6 months, and we just finished data collection in December. And right now my student is on vacation. And so we are going to start data analysis in February to analyze the 6-month data. But so far we can see some initial improvements in the overall nutritional adequacy and in the diet quality using this tool. So this gives us some preliminary evidence that the use of tool is effective in children who are newly diagnosed with celiac in clinic. That was really important from us from an Albertan perspective before we start to integrate the use of this tool directly into clinical practice. The other things we've been working on that I just want to mention briefly is the tool has some tips, but we wanted to make sure that families would have access to a gluten-free cookbook that would have recipes that have been tested and then also tie into the recommendations of the actual food guide. So you can see in the circle here that I'm circling is that the you can see that the aim is to meet fruit and vegetables. So we have different recipes, and then we make suggestions about how they can be integrated into an entire meal to promote meeting the recommendations. And we provide some nutrient information. For example, we will highlight whether this gluten-free recipe is higher in folate, higher in iron, higher in vitamin D. And so we elicited all of these different types of recipes trying to encompass breakfast, healthy snacks, lunch, eating on the go, and travel, because we really wanted to make sure that this is a complementary. It's still in process. We are also including other topic and suggestions for picky eaters. So if you're interested in contributing to content, like if you have your favorite recipe that you love, we do have a red cap survey, which you could click on, and if you are willing, you could share your recipe and share it with us. We are going to be testing the making these different items and having it taste tested in kids too, because we want to make sure kids do like the taste of these. And so these are just 2 examples of some recipes that we have. Right now we have about 56 recipes, and we're just looking to add a few more. So if anyone's interested, from assessing the guide itself, like the impact of the gluten-free food guide, we are going to also look on the effect on processed food intake and whether it influences cardiometabolic risk because if you remember, it's a higher gluten-free processed foods are higher in fat and sugar in a lot of cases. And so we want to make sure that the guide has tools that will assist with that. We do have a handout on added sugars and fat, but I think we may explore this a little bit more in a future study. And then, as I mentioned before, food insecurity is really important, the rising food costs. And although we have one handout in the guide that's talking about eating on a budget, we are exploring what other educational tools that could be added later to the food guide. And so right now we're conducting some ongoing cross-country surveys to look at the prevalence of food insecurity and how does it affect kids' dietary intake. And we are finding from preliminary results that even in higher income households, such as people who make between 100 and 200 thousand K a year, they still are finding that the prices of gluten-free foods and the availability of those, is particularly in rural areas, is challenging. And that really does affect how much income the family has available to buy gluten-free foods and healthy choices. And that really has been influenced from our preliminary results by the COVID pandemic. So I wanted to mention that too, because this study will help inform us about what kinds of additional tools we should be aiming to put into the guide in the future, because this is an important topic. So I just wanted to highlight that as well. And you may have seen our Facebook in the groups or in the Celiac Calgary chapter or Edmonton chapter, us asking for people to be involved in our studies, because all of these studies tie into our goal of continuing to develop and expand the content of the gluten-free food guide that we have. So as I mentioned, I do my research with a team called the Conquer team, and the Conquer team is a cross-Canada team. It's, for example, Roseanne in Saskatchewan, who I think you said was here, is part of that team. She's been great. Her dietitians assessed the content and the layout of the guide and gave us lots of feedback in focus groups. My graduate students, Rita, has been really pivotal in the final stages of the guide. And then my other graduate student, Sam, who's graduated now and gone on to work in the University of Alberta and other pediatric research, was pivotal. And Christine Lirette, my former RA. And also, I just want to acknowledge Dr. Turner in particular and her dietitians, Min and Jessica in particular. They've been so helpful. Dr. Gidrowitz from Alberta Children's Hospital, and then Peggy Marcon at Sick Kids, and the dietitians there and at McMaster. And I'm pleased to say that McMaster has already started to use the food guide in their clinic and giving it out in newly diagnosed children. And they started that on the day of release. And I want to thank everybody else, like the dietitians and the physicians across Canada from BC to Halifax, who gave feedback in their inter-D rounds when they allowed us to come on Zoom in focus groups and gave us feedback to help us optimize the content of the food guide. And then the members of the community, children and youth with celiac disease and their parents and families, you guys patiently came on to focus group and interviews and gave us feedback, and especially the kids. It was so helpful, and I really appreciate that. And then just acknowledging my other sources of funding. So it really does take a village to make a food guide, and I'm really happy about that. And if you see this is my final slide. And then I'll be open to questions. If you want to access the food guide, there's many ways to access it. For example, on the Celiac website, it's free for download. You can access it through this QR code, or you can come on over to my Instagram accounts. My students helped get me on social media at, on Instagram at conquer_celiac, or Twitter, now it's called X, at Conquer Studies. So we have a variety of ways that you can access the guide. It's easily downloadable. You can print out a single page or multiple pages if you want. And that was what we wanted. We wanted to make sure the public had full access to the food guide. So that just sort of highlights overall like the why we developed the food guide, and I'm open to any questions that anybody would like to ask me now. Thank you so much.
Thank you, Diana, for all that information. Fabulous work, very practical work too, very useful for the celiac community. As a parent of a daughter with celiac disease, very nice to have this resource. Open to questions. If anybody has any, please pop them into the Q&A box. So we'll just wait for that and see if anybody has any thoughts. Okay, Mike and Andrea asked, how much folate is an appropriate intake for an 11-year-old girl?
About 400 micrograms.
Okay. And you are noting that as Diana noted, folate or folic acid is mandatorily fortified in gluten-containing flours here in Canada. However, it is not in non-gluten containing flours. So if you are on a gluten-free diet and you're having your pasta that's made from gluten-free flour or your crackers, those are unfortunately not subsequently fortified. So we need to get that folate in another way, and that's why that you see more green veggies on this, which is really, really important, especially for as you get towards those childbearing years, because as we know, folic acid or folate is really important for the prevention of neural tube defects. So a really important piece of this food guide. Thank you, Mike and Andrea, for that question. Next question is there a multivitamin that means that or another supplement brand meets that, I think is probably what was meant to be said there.
There are a variety of gluten-free vitamin supplements out in the market that do have that 400 in there. A specific brand name, probably, Nicole, you might know that. Off the top of my head, I can't think of one right now, but I do have a list that we've just recently updated.
Yeah, I mean, I assume province to province companies might be a little bit different. Here in BC, there's a few brands that I recommend, not because I'm affiliated to them in any way or get any kickbacks, but Natural Factors is a good one, Jameson's a good one,
Yeah.
Sisu, SISU is a good one. Again, whenever I talk about supplements, please be sure that you're purchasing them in Canada. There's French on the label and there's a DIN number. So we know that Health Canada and the Canadian Food Inspection Agency have approved them. They've had their eyes on them. So this is safe for consumption. When there's no French on the label, that's a ticket or a key for you to know that this has not been approved by Health Canada for sale here. So we've got really robust labeling laws for supplementation, natural health products. Celiac Canada sat on a lot of conversations with the government on these. So just make sure that there's French on the label and that DIN number is there, and you should be fine.
I would also like to add that if you follow the recommendations of the food guide, you don't need a vitamin supplement for folic acid. You can meet your nutritional needs following these guidelines. Okay, sure, it could be you're not going to follow it every single day getting to half a plate, but you can meet your needs on average if you follow this type of approach even 3 to 4 days out of the week. So just something to keep in mind. I'm not against vitamin supplementation, but it is good to try different foods to see if you can meet your needs with food. And also because honestly, adolescents don't always want to take the vitamin supplement or they forget, right? So if you the guide will just make you feel a little bit more relaxed. Oh, if I didn't take the vitamin supplement today, that's okay because I'm following the guidelines of this. And that gives you some flexibility for either or. Of course, if your doctor says your child needs a folic acid supplement because their blood work shows that, that's a different story. Then you should definitely follow their advice regarding supplementation.
Yeah. Yeah, so if you have further questions on supplementation, find a dietitian, talk to your doctor in your local area to ask those questions for sure. Debbie says, not a question, but just wanted to share that I love the colorful handout, very eye-catching. Thank you very much.
Thank you so much. I appreciate that.
All right, any other questions? Otherwise, we will wrap this up with a big thank you.
Please
All right.
feel free to come by my Instagram sites for updates about the cookbook or the other research that we're doing if you're interested, or if you have any additional questions, you can email me at mager, M-A-G-E-R, at ualberta.ca. Feel free to email me. We're open to answering questions at any time. Thank you so much for the opportunity to
Wonderful.
share the guide.
You're welcome. Thanks so much for coming on tonight, Diana. We really appreciate all of your expertise on this topic. And for those of you who are with us, we've got lots more webinars coming up over the next several months. Next month, we have our CCA After Dark, where we'll be talking to Dr. Stephen DeWitt about a recent study that came out on relationships and how people are finding dating with celiac disease difficult. So we thought around Valentine's Day, that would be a good time to have that conversation. So join us for that. Sign up at celiac.ca under our events section. All right, thanks everybody. Stay safe, stay well.
Okay, thank you. Bye.
Okay.